And the patient will let you know what's going on. You just have to ask yourself, why is this happening? And do some reading about it, and you'll figure it out. The patients will tell you what's going on. You just have to be willing to listen. And if you don't understand, they're okay with saying, hey, right now, I don't know. But give me some time. Give me a week, and I'll get back to you. People are okay with that. It's okay to say you don't know. Saying it's in your head is not okay.
Hello, and welcome back to another week of Calling in Sick. I'm your host, Alex Willison. Oh, it is so good to be back in the seat with you guys. I decided to not take Self-Cept anymore, or my Fortic, because it was ruining my life. And as you'll hear in this episode, if something is ruining your life, you are allowed to pivot. There are other options. Sneak peek. That's not just coming from me. That's coming from a doctor. This week I brought in the amazing Dr. Zach Spiritos. He's a neuro-gastro-immunologist out of UNC. I did not know that specialists existed until I found him online, and I was blown away. It's like the perfect specialization for treating patients with complex medical conditions, especially those in the chronic illness population. So I'm super excited for you guys to hear all of his insights. I learned a ton. I also felt so seen and validated in some of my concerns and frustrations with the medical system and being a female with chronic illnesses that are sometimes labeled as invisible or fake. So if any of those things sound interesting to you, you are in for a treat. And if you don't follow him on social media already, go check out his Instagram and TikTok. He is hilarious, but also a wealth of information. And of course, Alex's picks. Housekeeping. For this week, if you have anyone in your life that has gastric issues or has been labeled as just having anxiety, this episode is for them. Send it to that friend. And in the comment section this week, I want to know what was the most surprising thing that you learned out of this episode, or what questions you have for Dr. Zach. I'll make sure that he sees them, and he's very busy, but he does respond to like everything somehow, some way. The man wakes up at 3 a.m. and gets everything done. And because this episode is all about gastro, and because this episode is about that mind, gut, body connection, my Alex's picks of the week are also in that bucket. First one is IB-Guard. I was first introduced to IB-Guard by a neuro-immunologist back in like 2020. And then I had a gastroenterologist reintroduce me to it in 2022. IB-Guard is 100% peppermint, and it helps calm down all of those IBS symptoms. Nausea, bloating, tummy pain. I love it because it's a clean, simple, and super effective way to treat that for me personally. If you guys want to give it a try, you can find it at Target, link in the description below. My second pick of the week is magnesium supplementation. Personally, I get my magnesium from Pure Encapsulation, link in the description below. I love it. They're clean. They do all of the testing. I know any supplement I get from them is going to be safe and well tested. But there's 2 different types of magnesium, and you do not want to mix them up. Magnesium glycinate helps with sleep and stress reduction and just calming you down, which is really great if you're having anxiety or sleep disturbances. If you're having issues with going to the bathroom and having regular bowel movements, you're going to want to look at magnesium citrate, which has a mild laxative effect. Now you see what I mean. You do not want to confuse those two. Regardless, if you're a chronic illness girly, magnesium might become your new best friend like it has for me. So check it out. Link in the description below. Happy sleeping, happy pooping, and I hope you enjoy this week's episode. Cheers. Hi, everybody. Welcome back to another week of Calling in Sick. This week I have a wonderful guest with me, Dr. Zach Spiritos. So nice to see you again.
Hey, so excited to be here. Thanks for having me.
Of course. I'm really excited to dive in. You are a specialist in one of the areas I'm trying to focus on this year to heal my own body and self and chronic illness isms, which is gastro-immunology. So can you tell the audience what that is and give us a little bit about who you are?
Yeah. So I'm a neuro-gastroenterologist. I say this all the time. Don't love the title. I wish we could workshop that. It's just too many syllables.
Just a little bit of a mouthful.
It is. And you can't really abbreviate it, but I mean, the 100-foot view is that I deal primarily with software issues as opposed to hardware issues. So when you see a gastroenterologist, they'll do a really thorough job looking everywhere for why you're feeling the way that you do, often starting with blood work, endoscopies, maybe some imaging studies like ultrasounds, CAT scans, and hopefully we find the answer there. And those are quote unquote hardware issues where there are objective findings on a lot of these testing modalities where we can see something, we can biopsy it. But when the testing comes back negative or inconclusive, that's kind of where I shine, and that's where I tend to take over. So I deal a lot with how the gut talks to the brain. I deal with motility, so how this GI system moves and empties and coordinates with each other. Because for a lot of people, upwards of 40% of people that come in with complaints in GI clinic, that's where their symptoms derive from, and so that's where I come into play.
Well, that seems like the perfect specialist for anyone with an autoimmune disease or chronic illness because it feels like we're getting more and more info that everything kind of starts in the gut. Would you
Yeah,
would you agree with that? That that's kind of like the new direction that
man, it's
let me
complex.
just let's
I
dive
wouldn't
into some.
say, yeah, I think that, man, the gut is certainly important, but we can't forget about the old brain. The
That's
brain's pretty
true.
darn important too.
We
And
need that
so,
one to survive, I suppose.
yeah, yeah, yeah. Although the selfish part of me wants to say that the intestines and the rectum is more important than the brain and the prefrontal cortex, I can't. No one's buying that argument.
Darn, I'm
That
sorry.
being said, a lot of what we deal with is kind of lies in the middle of both of them. So
Okay.
a lot of conditions, not all of the conditions that I deal with, are called DGBIs, or disorders of the gut-brain interaction. And so the condition kind of lies in the realm between these two things. So, if you were to point at one anatomical location that we're targeting or working on, it's the nervous system, right? Like that's how
Yeah.
these organs communicate with each other. They don't exist in a vacuum or independently. They crosstalk, they communicate. There's the central nervous system, which is our spinal cord and brain. And then there's our enteric nervous system, which is equally as elegant and important as the central nervous system. And they communicate. And a lot of conditions are due to kind of a maladaptive communication circuit between these two very important organ systems.
Okay, that's super interesting. I am a coffee lover. But when I got diagnosed with chronic illnesses and autoimmune diseases and went down the whole lifestyle adjustment route that most of us usually go down, I realized that what I was putting in my body had massive impacts to how I was feeling. And that included my cup of coffee. Not all coffees are created equal. In fact, most of today's coffees are loaded with pesticides, mycotoxins, and heavy metals, all things which super exacerbate autoimmune conditions and most chronic illnesses. So obviously, I went down the route to find us the best kind of coffee that's free of all of that junk, and I found Life Boost Coffee. Life Boost Coffee uses a true pure process. It's a rigorous third-party testing for over 450 toxins. So when you are brewing a cup of Life Boost, you know that you're getting clean, USDA organic, single origin sourced coffee that still is delicious but gentle on your stomach because it's low in acid and free of all those toxins. But in case you don't want to take a chronic illness girlie's suggestions and opinions, this coffee is actually created by a doctor and it's trusted by health professionals everywhere. So sip that coffee. You're going to taste and feel better without that mid-morning crash, without the jitters, without the stomach pain that comes from all the acid, and with the peace of mind knowing you're not putting toxins in your body. And because you guys know I'm a deal girly, Life Boost Coffee is offering my audience an exclusive 10% off for a limited time. So go to lifeboostcoffee.com and use code Alexandra10 for 10% off your order. But in case that's not good enough, Life Boost is also offering any first-time purchaser up to 58% off with their first order with the link in the description below. And because we didn't want to leave out, the Life Boost lovers, go and get a subscription and you can get 48% off your order every time. So happy sipping. Is that where, when we hear people talk about stress and how stress is such a catalyst and trigger for autoimmune conditions, is it that connection right there that's coming from?
Yeah, that's a really good point. And before I jump into that, stress is not synonymous with these GI conditions. Like I'm stressed. Like I developed a panic disorder in my medical training that I still kind of deal with today. Do I have GI conditions or symptoms? I don't, because it's far more nuanced than that. So stress is not synonymous.
I love
It's,
hearing that. That makes me really happy.
yeah. So when someone says it's, the language that sometimes providers use to describe this can be problematic when they say like it's stress, because
Right.
one, that's just it's not true. And secondly, it puts the onus on the patient. Like this is something that
Yes.
this is something that you're bringing on yourself. When quite frankly, like we're all stressed, man. Like we're all dealing with it,
It's
right? Why doesn't
2025.
everybody have it? Because there's
Yeah.
unique biology that sets people up for irritable bowel syndrome, GI pain, essentially immediate abdominal pain syndrome, all these kind of quote unquote functional conditions that stress certainly makes worse. But why is it there to begin with? And that's a really complicated discussion. And the scientific underpinnings are the following. We do think there's probably dysbiosis there, right? And I'm painting with a broad brush because there's a lot of conditions that I'm talking about here. Dysbiosis, which is kind of a microbiome that isn't as healthy as it possibly once was.
Okay.
Some talk about increased intestinal permeability, which is quote
That
unquote
like leaky gut.
leaky gut,
Okay.
and a hypersensitized nervous system, which can be caused by quote unquote leaky gut or increased intestinal permeability or dysbiosis. But it's usually a combination of these things that set people up for these kind of conditions, and stress can make it worse. We do know that, and there have been good studies that show that people who have had really traumatic childhood events and PTSD, whether that's physical, emotional, traumatic events, are at much higher risk for developing these conditions. And is it a cause of it, or do you develop it and then you're unable to kind of you kind of have maladaptive behaviors to deal with the pain? We know that when we are chronically stressed, that our ability to tune out pain signals is just it's not as effective as it otherwise would be. So
Right.
what's a beautiful thing about this job, and what I love so much about it, is not only do I get to talk about diet and getting you to go to the bathroom better and helping you with pain, but I also get to talk about mental health too, because it really, who cares if you're having beautiful bowel movements a day if you're hopelessly anxious and depressed and can't sleep, right? So
Yes.
you have to kind of talk about both of these issues. And I will say that it's really hard to poop really well and get that really beautiful log. Can I say log?
Yeah.
Log.
I swear on this podcast you can say whatever the hell you want.
Logs. It's kind of gross. I wish I had a better term for it. Nevertheless, it's really tough to have that beautiful bowel movement if you're stressed, if you're anxious,
Yeah.
if you're not sleeping. So we touch on all of these things. And when I meet with patients for the first time, goodness, it's an interrogation, right? We're going
Yeah.
from day one, how have things been? How was growing up? What was that like? Were you born via cesarean delivery or vaginal delivery? Were you sick in your childhood? Do you take antibiotics? And so, because it paints this whole picture, it gives me a sense of what's going on and what buttons we need to push to get you feeling better.
That's so interesting because I feel like a lot of Western medicine is siloed. We have all these specialists where you go really, really deep into something, but often for people with complex autoimmune diseases or chronic conditions, there's overlap in so many different systems. So you having this whole kind of whole person landscape because of your very interesting specialist that you have, specialization that you have, you get to see that whole picture. And I think that's really cool. Do you think that your specialist of neuro-gastro-immunology will become kind of like the new direction for managing chronic illnesses, or like will we find more of you, I
No.
guess is what I'm asking. No.
Well, look, so I am definitely mostly a GI doctor. Okay.
Fair. Okay.
I do wear a psychiatry hat a little bit, a dietitian hat a little bit. I am not nearly as talented as those respective fields. I have not had their training. I also do like mast cell activation syndrome and POTS management as well. So I do kind of branch out a little bit there. We can talk about how we got there.
Yes,
But
please.
for GI doctors, they didn't sign up to do this. They didn't.
Yeah.
We signed up to
End to end.
a lot of endoscopy, right? It's mainly a plumbing and not an electrical issue that we're looking for.
That's a really good way
And
to put it.
so our medical system doesn't breed people to think this way, right? And so
True.
when you do neuro-gastroenterology, it takes time to unwind the years of complexity that led up to where people are today. And when you go to a traditional doctor's appointment, how much time do you have, right? You have
10 minutes, 20
right.
minutes.
And they're looking at the computer, they're charting, and I'm in the system right now. Like I just got done a half day of clinic. I'm always running behind because
Yeah.
I'm always double booked. and my visits take too long and everybody's pissed off at me because I'm running behind. I try to take as much
Until
time
they
as I
get into
need.
the room with you, and then I bet they're like,
Yes, and they're pissed off, and I'm like, but I'm here for you. Like
and I'm
I'm
going to give you all of that time too.
exactly. And so it's just the current medical system doesn't lend itself to this kind of care, unfortunately. And
Yeah.
so yeah, I mean, but we kind of have been handicapped to begin with because everybody is so subspecialized. And we talk about
Yeah.
things like, IBS is primarily a GI condition and should land in GI clinics, albeit we should also be talking about mental health and sleep there. So unless
Yes.
the doctor knows how to do those things or pays attention to those things, you may not get kind of the full spectrum of care. But when we talk about like mast cell activation syndrome, postural orthostatic tachycardia syndrome, what's so challenging about these conditions is that they have a million symptoms that hit all the organ system: brain fog, fatigue, migraines, palpitations, shortness of breath. Goodness, it's everything. And IBS and rashes. It's just you point a symptom, they probably have you pick a symptom, they probably have it.
Yeah.
And so when they go to their primary care doctor and they say, okay, this is what's going on, and they list all of the symptoms that they have, in all likelihood, they're like, okay, you're going to see a GI doctor, you're going to see a neurologist, you're going to see a dermatologist, see an allergist, and they're like, this is ridiculous. I don't have time to see all these doctors
No,
because,
it's a full-time job then.
right, and you have to be able to piece this all together, and
Yeah.
that's where,
And getting people to talk.
right, right. And so these patients go years and years and years without a diagnosis, and it can be really tricky. Or they get a diagnosis, but they get, partial care because they see someone for their POTS, like a cardiologist, and they put them on a beta blocker and work with their heart rate, but they're not necessarily addressing their fatigue, their insomnia, their GI system, and so unless you have all these specialists, like a GI doctor that is kind of aware and knows about POTS and MCAS, and a cardiologist that knows about MCAS and POTS, and an allergist, like it's
At
going
the
to,
mercy.
yeah. And to give you some perspective, I'm currently with the UNC system, and our POTS, we have an amazing POTS cardiologist, and he's
Yeah.
booked out for,
Years.
I think, 2 years.
That's right.
The MCAS allergist, who's amazing, she's booked out till 2027.
Jeez.
And it's just, so who do you turn to? And it's just really challenging.
So who do these patients turn to? I feel like maybe it's they turn to the internet. And honestly, like when I first started getting symptoms that were a little MCAS-y, that's how I found your page and your profile because you were putting out content that was making me go, huh, maybe I do need to go get that looked at. Like these things are all making sense. They're connecting the dots. So how does a patient go about finding someone like you? Where's their hope to find that kind of clinician?
That's tough. A lot of it's probably word of mouth. So first
Fair.
you have to get a diagnosis.
Which
But
is
if
a
you,
pain in and of itself. Jesus.
and I feel like a lot of people are kind of putting together the pieces themselves. And if you're
Yeah.
listening to this podcast, I imagine you're kind of onto something.
Yeah.
And I think there are a lot of support groups out there because I have had patients with POTS and Ehlers-Danlos who found me on like local support groups. So I think it's reaching out to those communities. I don't think there's a perfect answer though. I don't. I do have to give a shout out to kind of naturopaths and functional doctors. I'm not very aware of what they do. Traditional allopathic medicine is much different, but they
Yes.
give patients lots of time to figure
Yeah.
out what's going on, and they exercise different options. And so I do, they're not a bad option. And I don't know what they specifically offer because I've never shadowed them or worked in their clinic before, but I do think they're onto something and giving people a lot of time to tell their story. Because maybe it's just that. It's just starting with gathering a lot of information and putting the pieces together. And even if they
Totally.
don't know necessarily how to treat it, then they can point people in the right direction for someone who can.
I think that's hitting the nail on the head. I think it's if you can have somebody that sits and digests and listens to your whole history and not just your history, but like you were talking about at birth, did something happen? And able to connect the dots from there, like that changes the entire game. The first time I had a doctor sit down and do that with me, it was like, oh, no wonder you have gut issues. When you were born, you inhaled mucosum or whatever it's called, like, and we're on antibiotics for the first 2 years of your life. That's a breeding ground for autoimmune conditions. Like, there we go. But you have to have a doctor who's super curious, and like the system today as it is, doctors are so overworked. Like you were saying, you're in clinic and it's runs out of time all the time. It's just really hard from all different perspectives. But I will say, I think there are some really interesting things that are coming out because people are curious. They're hitting that time bound and they're having to get creative on how they're kind of reaching out to patients or sharing information, which is what you did by going online and making videos to kind of educate patients on, hey, if you're having these symptoms, maybe look at this. And that's really, really cool.
Yeah, it's been amazing. I was not really on social media about a year ago, and then I just decided to, I realized there was a lot of not misinformation, but just a misunderstanding of how these things work, like how
Yeah.
our intestines work and why things are the way that they are, and why do people have invisible conditions. And it's bred such an amazing community. I mean, I look through all the comments and I get lots of messages, and I'm so incredibly touched that people share this very vulnerable information with me.
Yeah.
But I also learn so much from them because in this space of neuro GI, there's not a ton of data. There is data, but it's not nearly as studied as like cardiovascular disease or like antibiotic use for C. diff, whatever.
Right.
These things that have, objective data that you can kind of grab and
Decades.
see in biopsy. Like there's so much data behind that. But this space is more art over science. So
Yes, the gray.
I use my personal experience with patients, my knowledge of how medications work.
Mhm.
Think that I've read a lot and I always read. I'm always reading more. But the patients teach me all the time about little tips and tricks that they use or, something another doctor told them. And I network all the time with other neurogastroenterologists. The network is pretty small,
I'm sure.
but we're always talking. And for example, there's an amazing neurogastroenterologist up in the Pacific Northwest, Justin Brandler. He's a young guy. He went to, yeah, he's a Mayo doctor. He was a Michigan doctor. He's brilliant. And we touch base because look, there's just not a lot of us. And so we
Right.
exchange stories and tips and tricks. And so we're always learning. But I learn a lot from the patients as well. And that's on Instagram as well. I posted something about proctalgia fugax the other day, which is where you get this really sharp pain in your rectum.
Uh-huh.
And we use medications and somewhat stress management and just reassurance. And
Hmm.
that's not a complete thing. Just saying, hey, this is okay. It's not cancer. It's not Crohn's disease. That's kind
It'll
of
be fine.
what the guidance is. And that's horrible.
Yeah.
The guidance
It is
is
horrible.
it's horrible, but that's like the teaching because we just don't know what to do. So I use medications, right? And
Mhm.
then immediately there is about 20 pelvic floor physical therapists who were like, nope, we can do a pretty good job of this. And I
Interesting.
said, I don't know a lot of data behind it,
Hmm.
but I'm all ears. And they just went in on how it works and how, and how they can manipulate internally to
Yeah.
make this pain go in. I was like, okay, my mind has changed. I love it. And so I love this community of learning from each other and talking and working as a team together.
Yeah.
And so that's been a really fun, unintended, surprising part of this social media bit. I used to not love the social media thing. I just, being on your phone and I have young kids,
Yeah.
and I'd be on my phone or my young kids. But goodness,
Same.
this has been a beautiful thing and I really have enjoyed it quite a bit.
I'm right there with you. The chronic illness online community is pretty special.
It is.
And
It
one of the
is.
cooler parts about it is that, like, just natural curiosity that's there. There's not a cancel culture. There's not a, oh man, they said this, so they're never going to understand my story. It's everyone's very willing to learn and grow together. And I think that that's beautiful because that doesn't exist in very many pockets of our world today.
No, because everything else is kind of well understood in medicine,
Yeah.
I guess.
Yeah.
But like, yeah, everybody's uplifting. You'll see a
Mhm.
patient really pour their heart out in a post, and then you have immediately 10 people being like, "I'm so sorry. My goodness, that must be so tough for you."
Yeah.
And hey, I had something similar. Maybe try this or try this doctor. And so it's been, I don't know, it's been wonderful, and I really applaud all the people that have chimed in and participated in my posts. I really, really, really appreciate it more than you know, and I learn from you, and I value everybody's opinion. I wish I could respond to everything. It's gotten to a point where I can't, and that's
It's impossible to. You can't
created
hold
a
yourself to
tremendous
that.
amount of guilt for me. I'm up like late at night looking at comments, and I really want to reciprocate the energy that's given to me. And I
Totally.
wish I could. I want to let everybody know that. But I appreciate everybody.
Well, you are doing a ton, so throw that guilt right out the window because you got to also leave room and space for your own cup to be full.
I appreciate that.
So I'm sure that you see, I mean, you do, not I'm sure. You see a ton of people engaging with your content. I would assume, and this might be incorrect, but I would assume a lot of them are females because autoimmune conditions are more prevalent in women. From your standpoint, do you think that there's a like single reason, silver bullet reason that that's the case, or what is your whole perspective on why females are more often developing these kind of complex conditions?
That's such a good question. And so I think there's two things I'd like to address. And first is why we don't understand these conditions well. And is it a coincidence that women have a lot of these conditions? And I don't think the answer, I think the answer is it is not a coincidence, right?
I agree.
Women of childbearing age were excluded from clinical trials like until the mid late 20th century, like
That's
pretty late.
so fucked up.
And so, we realized there were studies where, women receiving certain hip transplants or hip replacements weren't doing as well because the hip replacement equipment hardware weren't studied on women's bodies. So they took
Click.
the data on men and applied it to women blindly, and it didn't work out. We for cardiovascular health, right? We realized in the 90s that women's heart attack profiles, their symptoms when they present are drastically different than men's.
Totally.
And we didn't understand that because they weren't included in trials. They take female mice out of studies because they think the hormones will affect the outcomes. And
Oh
so,
my God, I didn't know that. That's wild.
yeah. So the women are fighting an uphill battle to start.
Yes,
We know that women's pain is taken less seriously than men. In the ED,
absolutely.
women's pain gets treated less. They're less likely to get
Psychosomatic.
narcotics, right? And so, I believe the Greek word for I think hysterical came from the Greek word of uterus, right? And so,
Yep.
and there's this kind of the history of wandering uterus and blaming women's complaints on kind of this pathos and ethos behind the women's uterus. So
Yeah.
it's all really completely inappropriate and sad. So to start, these conditions are, I believe, in part partially or are misunderstood because of the patients who get them, who are primarily women.
Yep.
And MCAS, not a lot of people know about. POTS, not a lot of people know about. Ehlers-Danlos, not a lot of people know about. So if you look at like cardiovascular disease in medical textbooks, there's pages on it, pages and pages and pages on management. Conditions like irritable bowel syndrome, POTS, of the like, they get 1 or 2 pages, despite being infinitely complex and
Yes.
multisystemic.
And they get labeled, I feel like more often than not, as like blanket diagnoses. And so they're taken less seriously even by certain medical providers. Where if you have the diagnosis of fibromyalgia on your medical records, it's all of a sudden, like you don't really have that. You just,
Because it's due to stress, right?
yes,
Try meditating. Ooh, I'm stressed. Why don't I get that? Because there's something biologically different about them. There's real pathology. And we
yes,
think we got so cocky to think that we can measure everything, right? Just because the
yeah.
CAT scan's normal and the MRIs are normal doesn't mean there's nothing going on there. We're just not savvy enough to measure it.
That's so true. The best piece of advice my dad has ever given me, I was like at a very, very low depressive state, thinking I'm never going to get better. I have to just accept that this is how I'm going to feel. And my very wise dad sat down and he said, well, Alex, medicine's always progressing. Right now, we just don't have the tools to capture what's going on in your body, but it doesn't mean it's not happening. It just means we can't capture it right now. You just have to find somebody that believes you and will help you. And that carried me through that whole season. And obviously, now I'm out of that depressive state and doing a lot better than I was then.
That's a great piece of advice.
Yeah.
And, we got into this habit of not believing patients. Like, why would
Why do
they
you
just
think that
make this up?
happened?
You think they'd come in here to overwhelm us? Do you think millions of people with fibromyalgia or millions of people came together and were like, what we should do, guys? We should make up a condition and then all go to our doctors and overwhelm them at the same time. Like,
Yes,
why did we stop believing patients? It makes no sense.
it
And so
makes
the
no
patient will
sense at
tell you
all.
what's going on. And if you don't know what's going on, then find someone who does. It's pretty simple.
Yeah.
And
Do you think it's an ego thing where certain people will just be like,
no.
I.
Well, I think it's complex because I
Okay, that's
think
fair. Nothing's black
doctors
and white in
think they're
life.
all that, right? Because we
Yeah,
studied really hard and we read some books.
fair.
And look, there's a lot of work that goes into medical training. So
Yes.
it's okay to have some pride.
You should have some pride. Also, like, you have to have some kind of confidence, I think, to take care of
100%.
other people.
100%. But so when something is out there that you can't understand, right? We still live in this world of a lot of people believe in the duality of brain and body, right? So if people are complaining a lot about their somatic symptoms of the body, but it's not making sense, well, shoot, it must be in the brain. So it's stress. It's an easy way to
It is.
say it's something else because they don't necessarily understand it.
Yeah.
And it's not because they're lazy or we just weren't taught it in medical school, right? Like I didn't learn a lot about IBS in even GI training. You have to do it on your own volition.
Oh,
You
that's
don't learn about
interesting.
POTS in training or, even the cardiologists that I work very closely with who are POTS experts. I mean, in training, you're learning how to cath people and read echoes and managing heart failure. But the POTS management is 1/1000th of your training because not a lot of people, they don't either believe in it and there's just not a lot of, it's poorly understood. So a lot of, how do you teach something that's poorly understood?
Fair. And also, I think it's underappreciated the vast amount of knowledge medical providers have to learn during their training, that there's no one person should be responsible for understanding every single medical ism and that can happen in a body. That would be unfathomable. That's just like way too much fucking information for any person to actually know. I'm very intrigued to how AI is going to actually impact the whole education of med school and whatnot, and how that will potentially help some of these really complex cases and patients. But I do think, like, as patients, it's very, very easy to get exasperated if a provider doesn't understand your exact diagnosis when it's exactly right. Like, that's not in the textbooks. It's maybe PAN is like a page in a textbook, and that is it. Like,
Mhm.
you have to be specialized in what that specific diagnosis is in order to help that person. And as patients, we need to give grace that that's just how it is.
But it's tough, right? Because you're
It's
frustrated.
tough.
And I've been there where a patient is so sick and tired of being sick and tired. And I'm not quite sure what's going on in that moment.
Yeah.
And they can tell, and I'm frustrated and they're frustrated. And the conversation escalates.
Yeah.
And yeah, it just, these are poorly understood conditions. Anxiety can do a lot of these things too. So it's easy to say, hey, it's anxiety, it's stress. And anxiety and stress make a lot of these things worse. So it's messy, right? It's
Yeah.
convoluted. These things play off each other. But yeah, anytime anybody asks me to give advice to budding physicians and trainees, it's just continue to be curious. And if
That's
things don't
great.
make
I love
sense,
that.
pick up a book and read, or shoot, ask ChatGPT,
Yeah. I mean,
right? Like they'll
yeah,
give you
working
something back.
smart. Yeah.
And so, yeah, it's really tricky and it's tough to find the right medical team. And the question comes up like, how does a patient advocate for themselves?
I was just about to say, let's go right on that path. How do you advocate for yourself when you are getting told it's anxiety or psychosomatic?
Well, I think the question is why do you have to advocate for yourself? And the answer
Yeah.
is either your doctor doesn't have enough time or they don't know what's going on. So how do you ameliorate that? And I think it's being so there are some people that come with pages,
Binders.
symptom diaries, and I love that. I think for most people that can be overwhelming because it's just
Yeah.
like you have flip through pages. So I think it's being as succinct as possible and writing down like when your symptoms started, when did they, I guess, how have they been over time, what's worked, what hasn't worked, what research have you done, and what makes sense for you. I always ask my patients, what do you think is going on here? And most people are like, you're the doctor. Like that's a dumb question, but it's always like because I feel like a lot of people, you
Do
know,
have an idea.
do have an idea,
Hmm.
and people trust their own bodies. Like I just met you. I don't know your body. I know
Hmm.
bodies. I don't know your body.
Yes.
And people are like, I react really weirdly to. I had a guy today, for example, right? Okay. And he's been told he has IBS for years, and I'm probably his third GI doctor. And he's like, every time I eat meat, I hurt a lot, and I get bloated, and I'm like, I don't know what it is, like it's stress or I don't know. They're not sure what it is. Try this medication.
Yeah.
They will tell you what's going on. And so if you just ask yourself, like, what's different about meat? Like, how is he preparing his meat? So this gentleman, he cooks a bunch of steak in the beginning of the week. He's on the carnivore diet because he actually reacts to a lot of different foods,
Hmm.
and he reheats that meat every morning and cooks it, and then immediately after it gets bloated and has pain. And there's something called histamine intolerance where
Yes.
you eat the
Leftover.
bacteria components on that leftover food, even at the fridge, will through the process of fermentation create histamine. And the patient will let you know what's going on. You just have to ask yourself, why is this happening? And do some reading about it, and you'll figure it out. The patients will tell you what's going on. You just have to be willing to listen. And if you don't understand, they're okay with saying, hey, right now, I don't know. But give me some time. Give me a week, and I'll
Yeah,
get back to you. People are okay with that. It's okay to say you don't know.
totally.
Saying it's in your head is not okay. It's
I
not okay.
totally,
You
I
can
would
say
way
maybe
rather that.
stress makes this worse, because stress kind of makes everything worse.
Yeah.
But but to get back to the original point, succinct, writing down, your journals, your symptom journals, what makes it better, what makes it worse, what you think it is, what has made it worse, what makes it better, and why you think it's that in a very
Hmm.
succinct way. If you said, hey, I think this is POTS, my heart races, I stand up for a long time and I get nauseous, I can't sleep, I have tingling in my fingers and toes, no doctor's going to be like, that doesn't sound like POTS.
True.
And even if they don't know what it is, maybe they can point you in the right direction.
I love that. I think that like having a overview page or a summary page, and I always tell anybody that asks me like, how do you prep for doctor's appointments? Go in with a goal and tell that provider like, hey, I'm here because of this symptom and this is my goal. That just like puts you on the same wavelength of attacking the problem together, I think.
That's a great piece of advice, because for these chronic complex conditions, patients are already on guard.
Yeah,
Like they already know that they've probably been dismissed a few times. People
totally.
don't know what's going on. So they talk really fast and try to get everything in a short period of time. They're like, I have brain fog, my feet hurt, when I eat tacos, it hurts. And that's all great information. And I always let people talk and finish that. And they'll be
Yes.
like, what's the biggest thing that bothers you?
Yeah. Gotta have
And
one
that
thing.
usually that tells me a lot, because that usually will inform me what direction we should go, and informs what may be going on. Sometimes it doesn't, but for the most
Yeah.
part it does. And also we attack that symptom. Like we'll get that under control first, and sometimes when you do that, all the other things will fall into place. Sometimes
Yes.
in mast cell and POTS, literally there's so many disparate things that you have to do individually, and that can be quite challenging. Um, and I will say that for these chronic complex conditions, it is an iterative process. Like we start on day
Yeah.
one and we figure out what's going on and we start that process, and then we work. And we have a lot of touch points. I touch base with my patients every 2 to 3 weeks. If I don't hear from them in 2 or 3 weeks, I get upset. I get upset. I don't I don't lambast them or admonish them, but I'm like, help me out. Like we need to
Yes.
talk through this.
We're doing this
Um,
together. We're teammates.
Exactly, we're teammates in
Yeah.
this, and so I create a lot of touch points. I think that's
I love
very
that.
important, because it's an iterative process. We want 30% improvement over a couple weeks, and over a full year, maybe you're an entirely different person. But we need to work together, and we are a team.
Yeah, and I think that's such a good way to put it. It's an iterative process. If you're new to the chronic illness game, I think a lot of people go in because we live in a world where healthy people think, oh, you get sick, you get on a medication, you get better, and you're done. So when you get sick and all of a sudden you're on a medication, you're not getting better, your doctors are telling you to wait, it's a process. It's a lot of trial and error because each of us are different because of our GI systems and we're unique little snowflakes. So we're going to respond to medications differently. And those medications take sometimes 3 to 6 months to start actually working. A lot of patience. So knowing like you're in it in the trenches together with a provider, you're going to figure it out, but you just have to be honest and you have to be open minded and patient goes a long way.
Yeah, I try to set those expectations up
Yeah.
front. Like
Yeah.
this isn't a broken ankle. I can't reset it. This
No,
isn't a
I
pneumonia or a
wish.
UTI. Yeah, this isn't a as simple as a one medication will turn things around. You've tried many medications. There's not a world out there. There's going to be one medication that turns everything around. Yeah, we can use medications and they will start to move us in the right direction. But we layer things. We layer diet with lifestyle, with sleep, with medications until we're at a place where you're happy. And we may not turn this around altogether.
Mm-mm.
We may not.
But
This
if you
is
can get,
that's the reality of these really challenging conditions that sometimes can be lifelong. But we want it to be manageable,
yeah,
and you have kind of break glass in case of emergency plans when things are going haywire. And I'm
yes.
always going to be here. Like I'm always going to be here. And even if I don't have the answers, I'll listen, right? And maybe I can
Mhm.
coach you through it. But um, yeah, it's really challenging. It's really challenging.
Well, it goes a long way just knowing that you have a provider who's willing to listen and be there with you. So I'm sure your patients are very, very grateful for that. That's awesome.
It's fun. It's fun.
Okay, one of the things I would love to dive into is, and we kind of touched on it a little bit earlier, but why do people think some of these conditions are fake?
Uh, yeah. Okay. I realize I missed one of your past questions about why women get these conditions as well. So
Oh, yeah.
maybe we can kind of tie that together.
I think they probably go hand in hand.
Right. So why do women tend to get POTS, EDS, and IBS more than male counterparts? And one is probably hormones, probably play some role. Like what makes women different than men is hormones, right? And so
Yes.
we do know that estrogen plays a big role in POTS. It can help dilate the vessels, which is not a helpful compensatory mechanism in POTS.
Nope.
Ehlers-Danlos, right? Uh, and in
Lupus too. Man.
yeah, it can lead to more kind of more lax tissues, and that happens in pregnancy, right? And so
Yeah.
a lot of times in Ehlers-Danlos, women get pregnant and they never really kind of their joints never reset because their collagen is forever elastic. Mast cell activation, estrogen can make mast cells a little bit twitchier, whereas testosterone can be more protective.
Do you
So I
think there's
do.
going to be more research on the impact of hormones and autoimmunity?
I hope so, because there's definitely an interplay there, right? So the other part of this question is autoimmune. Women tend to get more autoimmune conditions, and so I don't think I have a good answer as to why that happens. But if you are a woman and you have POTS, like I'm always looking for an autoimmune driver for this. So I'm always ordering labs to look for, acquired autoimmune gangliopathy and Sjogren's disease, right? Things
Yeah.
that have some autoimmune underpinning to their MCAS as well. Like I will order autoimmune labs in MCAS as well because there are different buttons and dials that we can turn. So I don't know. I don't know. It's I'm sure someone a lot smarter, a geneticist, hormone expert can give you a more elegant answer, but it's a combination of increased proclivity for autoimmunity in addition to kind of hormonal.
That makes sense.
And so that's about it. And yeah, it's tough. It's tough. And then you mentioned, why do people think they're fake?
Hmm.
Um, I don't know the answer to that. It's tough. If I were to take a guess, I think they're poorly understood, and so you can't biopsy it. You can't see it on an image. Maybe it's made up. You know.
Yeah.
But I
It's
always go
easier
back
to
to
say that.
why would people make this up? Like
Yeah.
patients don't want to be in a doctor's office.
No, that's always the most mind-boggling thing to me. It's like if you're already working a job and then you're now having a chronic illness that you're quote unquote making up, you're spending a lot of time at the doctor's office and not a lot of time at work, and all of your stress is just going to get a lot worse. So it doesn't sound like the best thing to make up, in my opinion.
Nobody wants to hang out at a GI doctor's office. We have way too much lubricant here and great exams too often to make life pleasant for you. So
I'm
no,
dead. That's
nobody
hilarious.
likes. We are the dentist of the allopathic medicine.
Honestly,
Um,
it's true. It's true.
so yeah, and so so you can't biopsy it, you can't see it. Patients tend to have comorbid anxiety, but like who wouldn't, right? If you have
Yeah.
pain all the time and you're running to the bathroom and you can't stand up without fainting, wouldn't that make you nervous and anxious? Like that makes
Yes.
sense. That seems to be a very reasonable epiphenomenon of these conditions, and in turn can make a lot of these conditions worse. And then let's just talk about POTS for a second.
Hmm.
So POTS, by nature, fundamental to POTS is an overly active sympathetic nervous system, and that's it's very complex. But one of the thoughts is one of the many contributors to that is that your lower extremities don't contract as well as they should. So when you stand up, you're just not getting adequate blood flow to your heart and brain. So when your heart sees less blood flow, it will try to compensate by squeezing faster. So your heart rate will pick up. And what does that feel like? It feels like anxiety. So
It's shitty.
they have this kind of they're just always revved up, and it's tough to sleep. It's tough to focus. And so they have real chemical changes that masquerade and mimic are almost exactly the same as the chemical changes that you have when you have pathologic primary general anxiety disorder. So it's complex. It's complex. But
Yeah.
I always, I always, there's no reason to not trust patients.
I agree with that. When you do have a patient that is not seeing you, let's say they're seeing a different provider, because this is just not going to happen with you, uh, and they're hitting a wall with them, what is like your number one tip for them to advocate for better care, or when do you just throw in the towel and say, I'm going to go find a second, third, fourth opinion
I
and
think
pursue a different?
I'm always a big believer in open dialogue. I will put all my cards on the table. And if someone's uncomfortable, an examiner's like, you look uncomfortable. Like, what could I be doing differently? What can we be doing differently? So, I think it's tough because it all depends on the provider that you're talking with and if they're interested in having that dialogue with you. If they're saying, "Hey, I'm right, like I got nothing else to offer. You got nothing going on. This is all upstairs," then I don't know. I don't know if there's a lot of runway there.
Yeah.
But if you have someone, not every doctors aren't perfect. They don't always say the right thing or do the right thing, but you want someone who is on your side. I think, yes, you just want someone who's on your side and listens to you and believes you.
Yeah.
And if they don't have the answers, like that's okay. But maybe they just need to put you in the position to succeed. So maybe that's doing some research, finding someone who can deal with with whatever's going on and put together the dots for you, or put together the pieces of the puzzle for you, even if they don't know necessarily what buttons to push themselves. So I would say that if they're not on your side, if they're not listening to you, if they don't seem to be rowing in the same direction as you and taking you seriously, then I don't see any benefit staying with them.
I agree. I think, it's kind of like if you're having symptoms from a medication for a year that are more debilitating than your actual chronic illness, you probably wouldn't continue taking that medication. So why would you continue just accepting medical gaslighting when you could maybe feel a lot better seeing somebody else? But I
Yeah.
think people get overwhelmed by having to work that system.
Right. And if you're really sick and you have the doctor's office circled on your calendar
Yeah.
and you're really excited for it, and then you get there and everybody's a little bit on edge and the doctor's running behind, and it's so tough to kind of gather your thoughts and have
Oh my
like
gosh,
a
yeah.
mature conversation of saying like, look, we're not getting anywhere. Like, where can we go from here? Like, what's
Yeah.
happening?
Yeah.
Because the doctors equally, I'm sure they saw your name on their schedule and like, I don't know what to do here. And they come in defensive. And so it's all about honest communication.
I
But
think
that can
that's a
be tough
really
when
good rule of
people are
thumb.
sick and they're tired and the doctor's frustrated. So, but again, if someone's not listening to you and they're not on your side, then it's probably time to move on. Yeah,
Yeah, I think that's probably the perfect piece of advice for that. I think I get a lot of DMs in my inbox about I've had this awful experience. Blah, blah, blah. I'm like, you don't have to. You don't have to stay with that. A lot of people switch therapists. It's kind of like that too. But I also think like there is a moment of giving grace, and it could be a one-off thing. I like to say doctors are like parents. Like, yes, they are going to give you guidance and good help. They're also human beings, and they're going to mess up, and that's okay. And you're just going to keep on moving forward together.
exactly. I think that's very well said.
So let's talk a little bit about your next chapter because you're doing some very exciting new things.
Yeah. So I am creating a new clinic called Ever Better, where we deal with chronic complex digestive conditions, everything from difficulty swallowing to problem with belching to quote unquote IBS, or kind of unexplained GI conditions that have yet to be understood and properly treated. I also am treating dysautonomia and POTS and mast cell activation syndrome. And we also are doing weight management as well. My partner, Dr. Millard, was a long time weight management physician at Northwestern. He's amazing. We trained together in residency at Emory. And yeah, so we both kind of envisioned doing something different as physicians. And we both felt that with what I see in clinic and what he sees in clinic, they're infinitely complex and require time. And we just didn't have that. And when you work for a big hospital system, oftentimes you have to see patients in this amount of time, and you have to see them every 3 6 months, 3 months if you're lucky, but more often than not 6 months because you're so backed up. And so we wanted to create a different healthcare delivery model where it's accessible, so it's telehealth. And we're
Love
going to miss
that.
seeing people in person, but we prioritize accessibility. We know a lot of people out there are struggling and want answers. And I'm going to miss seeing people in person. But I think that I've done this long enough where I can glean a pretty good sense of what's going on by interview. And I
Yeah.
may ask you to perform physical exam techniques at home, which I do all the time because I see patients in telehealth. Like I've seen them once in person.
Yeah.
I'll see them at home. I'm like, can your husband or wife do this and see if it causes pain? Like that actually helps me too. Like we can do all that. Like we can get creative.
Yeah.
We spend a lot of time with you and we have a lot of frequent touch points. And we have a dietitian, an exercise physiologist, for POTS who are making personalized workout plans because we know that deconditioning plays a really big role in POTS pathophysiology for obvious reasons. And so we're going to help people work out again and lift weights again and all these things that I really, really believe are important parts of creating a thorough and holistic healthcare plan, but we just are unable to do so in our current model. So that's what we're creating, and we're really excited about it.
I'm really excited about it too. I think this is like the next wave of how chronic illness is actually managed within the US, as it is breaking out of the systems that aren't really serving us. We don't fit into a box, so why address it with the box that currently exists? We can go do something else. We don't have to rebuild the wheel, but we can pull the best parts and make something unique and special. And you're absolutely right. Like, if we learned anything from COVID, it's that so many things can actually be done virtually that we had handcuffed and said, no, that can't happen. And medicine's absolutely one of those things, which is so cool because it allows you then to open the aperture for all of these different patients that need help that might be, handcuffed, not be able to come see you physically even.
Very well said. And, there's amazing, Mayo is great. Michigan is amazing. There's all these great, centers that offer multidisciplinary care for these complex issues. It's just tough to get there. Right. And so
it's hard to get accepted into them too.
Right. And so we want to be accessible. Because it shouldn't, what I've learned from this social media experience is that there's a lot of people struggling without answers, and we want to help you put that together. And we want to help you do that. It is a cash-based model, which keeps me up at night still, and it breaks my heart. And we're going to try to accept insurance as we go along. But we're not doing any procedures. And so I spend a lot of time with you to figure out what's going on, and I try to bill your insurance. We're not going to survive a month financially. So we had to strike that negotiation. And if we, at some point in time, there's an inflection point whereby we can take insurance, we'll certainly do that. But right now, it's going to be cash-based practice. We're very open and upfront with our prices. They're going to be on our website, which is going to be up later this month. And when people can, at that point in time, can sign up for a visit. But we also I'm the boss. If I think that you can't pay it or something, we'll figure something out. I don't want to say that we're going to give free care away because we still have to pay the bills, but we can make things work. And what I'm a big proponent of is kind of our patient messaging system. And so I use it right now. So I touch base on patients every 2 to 3 weeks. So you got to give me updates. We got to keep pushing the plan. I see you every 3 to 4 months, but we need to make progress between now and then. It makes no sense not to. I can communicate with you. Why don't we do it? So even though you work with us for a finite period of time, or it's, we have 3 visits in 6 months, whatever, we are touching base every couple of weeks to push the plan. And we offer urgent care slots. If things come up, you can pop in and get an urgent care visit. That's part of your quote unquote membership. So we're trying to be flexible. I'm building this plane in the air. I've never done this before. I'm really excited to do this and learn from my patients. And I love feedback to figure out how I can serve you guys better and how I can do a better job being a doctor.
I think that you're going to just crush it. I mean, the energy that you bring, even just talking about these things, you're changing how chronic illness patients have hope about getting care and getting to feeling better and actually thinking that they can have an improved quality of life. So thank you from me, and I'm going to just speak for everyone, for taking a chance on that. I know it probably feels bizarre to have to do cash models or whatnot, but it's a business. We live in America. This is a corporate world. And I also know that you'll make it work for each patient, which is really beautiful.
What makes me feel better is I needed a lawyer for something recently, and I spent an hour with them, and they charge triple what I'm charging.
Oh man, yeah.
Okay. And then they did some paperwork. Not to belittle or minimize what they did. I really needed them.
Yes.
It wasn't anything. I didn't do anything illegal. It was for a business. I feel like when I said that, I was I didn't need to get out of jail, or I didn't.
Starting a business does have some legal needs that you have to put in place, and they are very expensive.
Yeah, but we will work with you, and we are flexible, and we have one goal in mind, is to get you better. And I have a whole network of amazing people within the dysautonomia, EDS, MCAS world. So if we need to get you a surgery, we need to get you a procedure, treating median arcuate ligament syndrome or craniocervical instability, we have a network of people to support you. So I can, at the very least, plug you in the right direction so that we can set you up for success. And then, we work with people for a finite period of time before we send them back to their teams saying, hey, here's what's going on. This is what I would do over the next couple of years. But we're always here for you. You don't have to pay for another visit necessarily. But if you message me 6 months after working for each other, you don't have to buy another visit. You can just say, hey, man, like, this is going on, can you help me through it? And I can pick up the phone, I can message you. Like, we're all about being flexible and putting you in a position to succeed.
You're a good human.
Well, that means
A very good human. Okay, last question, because we got to wrap, because we got to get you on an airplane pretty soon here. My last question is, how do you suggest patients go about researching for some of these harder to understand diseases? There's resources like you online, on social media. Where else can they turn and look before they maybe take the plunge into actually booking an appointment?
Yeah, absolutely. So, there are amazing podcasts. So I do read a lot. I'm diligent at getting up at 3:30 in the morning, getting in a workout and starting my
Holy cow.
my reading. I'm like brain dead after 6 p.m. So that's just the way my
Okay, fair.
circadian rhythm works. It is what it is. My wife can sleep all day, or she doesn't
Yeah.
really
You
turn
got to
on her
make it
phone.
work for you.
Right. It's about. I listen to a lot of podcasts on EDS and POTS and MCAS as well. The Bendy Bodies podcast, I'll plug
So
that. I
good.
have no kind of financial incentive there.
It's a
It's a
great one.
wonderful podcast. Yeah. The POTS cast is great as well. And they just have a lot of experts and also patients weighing in on kind of how they've kind of weathered the storm and gotten through really challenging, how they got through college with MCAS and EDS. And I learn equally as much on those podcast episodes as ones where they have kind of more didactic sessions.
That makes sense because it's a full picture then.
Yeah, exactly. And so I love listen. That's how if I'm working out, I'm listening to a podcast. And then, the society guidelines, there's great I'm forgetting off the top of my head the websites for POTS, EDS, and MCAS off the top of my head, but there are
We'll drop in
really
the
good.
in the description and whatnot so people can just click on the links.
Yeah, and so there's great literature there as well.
Cool.
There are good books out there as well. There's a really good Ehlers-Danlos one. I feel like it's Flexible, or I can't remember. I read it a few months ago, but there are really good books out there as well. And so I would just, I think podcast is a good place to start. And like browsing literature on Amazon, there's some really good books out there too. And the society guidelines are pretty helpful as well.
Awesome. Well, we will drop all of those resources in the description so that you guys can start to noodle and do your own research and feel good about going into your first appointments as you feel ready for them. But thank you so much for being on this podcast. It's been such a treat to get to talk to you and pick your brain about all of these different topics. Thank you for being an amazing provider. I think it gives me a lot of hope as I've had this like bumpy kind of medical last year, and it gives me a lot of hope that there's going to be new things coming on the horizon at all times that will help people like me.
I'm a huge fan of yours. Thank you for what you do, really from the bottom of my heart. And really thank you so much for having me today. It's been an honor.
Thank you. Appreciate it. All right, guys, thank you for calling in sick, and I will see you next week. And that's a wrap. Thank you so much for joining me for another week of Calling in Sick. As a reminder, I would love for y'all to like, follow, subscribe, save, share with a friend, do all of the things. It truly helps grow this community, and it helps these episodes reach the people that need them the most, whether that's for an educational piece, to have a little laugh, or to not feel so alone. As a reminder, Calling in Sick sits on YouTube, Apple, and Spotify, and anywhere else where you can find your listens. From the bottom of my heart, I absolutely love you guys. Thank you so much for calling in sick with me every Monday. It's been an honor and a pleasure so far, and I can't wait to continue. I can't wait to continue building this community with y'all. Love you.